Whipworms are another type of helminth that can be transmitted through the oral fecal route. Whipworms are very different from Ascaris worms, but have a really similar life cycle. The eggs are placed into warm, moist soil through fecal material and can be ingested by playing around with dirt or just touching dirt and then ingesting the eggs that way. The eggs hatch in the small intestine and release larvae that mature and migrate to the large intestine where they take up residence. Again, females can lay thousands of eggs per day, and the lifespan of the adults is 4 to 7 years. In most cases, whipworm infections produce no symptoms, but can cause abdominal pain, diarrhea, and rectal prolapse, particularly in small children. Next, let's talk about trichinellosis, which is what you can get if you eat raw or undercooked pork. Trichinella spiralis is what causes trichinellosis. And this can also happen if you like to eat wild game, including bear, boar, walrus, or seal. Pork or other meat that contains trichinella cysts can be ingested if undercooked, and digestive juices dissolve the hard covering of the cysts. Roundworms emerge in the small intestine. There they mature, and after mating, adult females lay eggs that develop into larvae. The larvae then migrate through the blood and lymph vessels and are transported to the muscles, including the eye, tongue, diaphragm, and chewing muscles, within which they form cysts. Early symptoms of trichinellosis occur within only 1 to 2 days after infection and include nausea, diarrhea, vomiting, fatigue, and fever, followed by later symptoms of headache, chills, aching muscles, itchy skin. And if the burden of worms is heavy, the individual may experience cardiac and respiratory problems as well. In severe cases, death may occur. Mild cases may never be diagnosed and are limited to flu-like symptoms. Our next disease is called guinea worm disease, or otherwise known as dracunculiasis. A word of warning, the next picture can be a little disturbing, but it is worth showing you because this picture is exactly what causes the most pain and most well-known characteristic of this particular disease. Dracunculiasis, also called guinea worm disease, is caused by the parasitic roundworm Dracunculus medinsiensis. The life cycle is initiated by drinking water contaminated with the Dracunculus larvae. Small copepods, essentially insects that live in the water called water fleas, feed on the larvae. These copepods are small crustaceans. And when someone ingests water containing the infected copepods, the copepods themselves are digested in the body. But the worm larvae, which exist inside the copepods, are released in the process. These larvae penetrate the stomach and intestinal wall and enter the abdominal cavity. Over the next year, the larvae mature into adult worms. Sexual reproduction takes place, male worms die, and the females migrate toward the skin surface, most commonly the foot or the leg. A painful blister eventually develops, and in many cases, people want to relieve this painful blister by dipping the foot or appendage into cool water. The temperature change can induce the blister to open, exposing the adult worm and causing her to release eggs into the water, completing the life cycle of this particular helminth. Symptoms of infection occur about 1 year after ingestion of the water contaminated with the copepods. A few days to several hours before rupture of the blister and emergence of the worm, fever, pain, and swelling in the area occur. After the rupture of the meter-long worm begins to enzymatically bore its way out through the skin, cutting the flesh during its migration and causing excruciating and debilitating pain for the individual infected. The most you can do is coil the worm around a small stick, because if you try to pull on the worm, that can end up killing the worm, leading to infection, which could be much worse, even possible death. There is no anti-helminthic medication available for the guinea worm disease, and healing at the blister site takes place in about 8 weeks. But again, even then, secondary bacterial infections can become problematic. Prevention of the guinea worm disease is based on teaching villagers in infected communities, many of whom are illiterate, to filter water through cloth or nylon filters to get rid of the copepods. As a result of education and these preventative simple measures, guinea worm disease is set to become the second human disease eradicated after smallpox. As of April 2018, a total of 187 countries are certified free of transmission of guinea worm disease, and only 3 cases have been reported to the World Health Organization in Chad, Ethiopia, and Mali. There is a problem with completely eliminating guinea worm disease in that dogs can become infected and can remain as reservoirs in nature for long periods of time. Next, we'll talk about other helminth infections, including tapeworms. Tapeworms are transmitted from 2 of the most common species, Taenia saginata and Taenia solium. Taenia saginata is the beef tapeworm and Taenia solium is the pork tapeworm. Their life cycles are very similar and begin with the ingestion of undercooked beef or pork containing encysted larvae. The beef tapeworm is the larger of the 2 and can reach 20 to 25 feet in length, whereas the pork tapeworm reaches approximately 15 to 20 feet in length. Upon ingestion, the encysted larvae are digested except for the scolex, or the head. This attaches to the intestinal wall by suckers. The scolex produces compartment-like segments called proglottoids. These are reproductive bags containing both testes and ovaries, capable of producing up to 100,000 eggs per proglottoid. These can detach from the worm and migrate to the anus and leave the anus either during defecation or on their own. Approximately 6 per day are passed in the stool or leaving the body on their own, and the eggs can survive for long periods in the environment. The larvae that hatch from the eggs, when ingested from soil or vegetation, penetrate through the intestinal wall and become encysted in the muscle of an animal. When humans ingest these cystosterae, the cycle is completed. Both of the beef and pork tapeworms produce only mild abdominal symptoms, if anything. Laboratory diagnosis is made by identifying the eggs and proglottids in the feces. Easy medication is available for treatment of the tapeworms. However, a serious disease called cysticeriosis can result from the ingestion of pork tapeworm eggs. This is essentially a human acting as the animal host. The eggs are passed in the feces of an infected person and if that person doesn't wash their hands, can contaminate food and water or surfaces. The eggs can then be ingested, and the tapeworm eggs hatch inside the stomach, penetrate the intestine, and travel through the bloodstream, ultimately causing cyst formation in muscles, brain tissue, or the eyes. In the brain tissue, it's particularly dangerous and can cause neurocysticercosis. In the brain tissue, the larvae can grow and cause brain damage and eventual death. Other helminths can be transmitted by arthropods. One of the more noticeable of these that you may have heard of is elephantiasis. Elephantiasis is so named because it causes enlarging and thickening of skin tissue in areas especially of the legs and feet, and is an unfortunate name for an unfortunate disease. A better term is lymphatic filariasis. The grotesque swelling in the legs does have elephant-like characteristics, and the texture and appearance of the skin resemble the hide of an elephant. The disease is caused by a tiny adult thread-like roundworm called filarial worms, which block the lymphatic vessels and cause the accumulation of large amounts of lymphatic fluid in the limbs. Lymphatic vessels function in the body's fluid balance and are supposed to return lymph back into the blood circulation system. But blockage of the lymphatic system results in a backup of this lymph, causing swelling, particularly in the legs. The affected areas may swell to several times their normal size. In males, the scrotum and penis may be involved, and in females, the breast tissue may become considerably enlarged. Most of these filarial worms are in the scientific group Wuchereria bancrofti, which causes 90% of cases. These are initiated by the bite of mosquitoes carrying the filarial worms. The larvae migrate into lymphatic vessels where, within about a year, they grow into adult worms with a lifespan of several years. Adult filarial worms mate, and the females release millions of microfilariae that may be ingested by mosquitoes taking a blood meal. About half of the people with lymphatic filariasis have overt clinical disease. The early symptoms are chills, fever, and inflammation of the lymph nodes. Some individuals can remain asymptomatic and may never develop elephantiasis at all. The disease is usually not fatal, but it does carry a social stigma because of its extreme disfigurement. Individuals are usually shunned to the point their families neglect them, and their disability may cause them to be unable to work. About 65% of the cases of elephantiasis occur in Southeast Asia and 30% in Africa. A strategy to eradicate lymphatic filariasis involves the use of massive drug administration repeated annually for at least 5 years. It does seem to be effective, however, and is a hopeful solution to this issue. In the next section, we're going to talk more about other arthropod-borne helminthic diseases.